Every day, millions of Americans suffer from a vein disease commonly known as varicose veins. Over 1 million people each year seek treatment for the painful and debilitating consequences of this disease. Chances are, if you are viewing this video or have made an appointment to see a doctor specializing in the treatment of vein disorders, you are one of the millions of people who seek treatment each year. Varicose vein disease is noted by enlarged, twisted veins raised above the surface of the skin. Varicose veins often result in symptoms ranging from slight tingling to painful aching. This video will describe the causes of varicose veins and non-surgical treatment known as endovenous laser therapy. Varicose veins are one of the most common vascular diseases, affecting approximately 25% of women and 15% of men in the United States. Historically, a surgical procedure known as vein stripping was the standard of care for treating varicose veins. Vein stripping is performed in an operating room using general anesthesia and is associated with a painful and lengthy recovery period. Now, many physicians have replaced surgical vein stripping with a non-surgical alternative called endovenous laser therapy. Endovenous laser therapy is a proven treatment alternative for the vast majority of varicose vein patients. Endovenous laser therapy only requires a minimal incision, no hospitalization, and laser patients are often able to walk and return to normal activities the same day. Dr. Shuster discusses benefits of the laser procedure versus vein stripping. He will give personal testimony from his past experience with both therapies.
The benefits of endovenous laser ablation are that they're much less invasive. They do not stimulate angiogenesis, which is the progression of vein growth post-procedure, and they provide less risk for the patient when they're going through the procedure. Post-operatively, there are key differences between the two procedures. In endovenous laser ablation, just needle sticks are used and requires just wrapping of the leg with very minimal discomfort, as opposed to old-fashioned surgery, which was incisions placed on the skin, requiring even narcotic analgesia to maintain pain control. That's not the case with endovenous laser ablation. Post-operatively, endovenous laser ablation patients have minimal pain. Their pain is generally controlled with Motrin for about 24 hours post-procedure. They're able to return to normal activities within 24 hours and physical or cardiovascular activity in up to 5 days. As opposed to traditional vein stripping, which required incisions and staples and sutures to be removed, these patients often required narcotics for pain control and could not resume normal activity for up to a month. Endovenous laser ablation has very few complications. Some would consider them just bruising and some minimal discomfort. As we know, traditional vein stripping was fraught with complications, resulting in DVTs and skin infections, proliferation of other veins, and even damage to the skin.
So what causes varicose veins? In healthy veins, blood travels in one direction only, up the leg toward the heart. To prevent the backflow of blood down the leg, a healthy vein contains valves which open and close to assist the return of blood to the heart. These valves open and close with the contraction of the leg muscles. In contrast, when these valves fail to function and do not completely close, blood can pool in the vein. This in turn causes the vein to expand and create the visible bulging known as varicose veins. If left untreated, this can lead to a restless feeling in the legs, difficulty walking, and even open sores. Heredity is a contributing factor in 70% of all varicose veins. Other factors causing varicose veins include pregnancy, age, obesity, and occupations that require long periods of sitting or standing. Tina Walters discusses the factors that caused her to seek treatment, including itching and the appearance of her legs.
Swelling, aching, just tired feeling, like your leg is just tired is the best way I can describe it. Yes, yeah, it's an achy, throbby, tingling kind of pain. It's the sort of thing where it's, at first you kind of think, at first I thought it was more of a muscle type of thing, and you want to like massage it out, because I do run, and I thought maybe I'd twisted or done something muscular, and then over time though you can certainly see the varicosity there in the leg, and so you can see the bulging, and then you can definitely feel it. Exactly, like I will wear capris instead of shorts. I will wear pants instead of a suit to a meeting or something like that, a skirt suit. So yeah, it definitely affects a lot. I was at a football game and it was brutally hot, and I did have on a pair of shorts, which took a lot for me to put on. And I was standing there with a group of other women, my peers, and one of them actually noticed it. and said, really, what is that? What is wrong with your leg there? And so, none of them had varicose veins, but I did.
Treating varicose veins by endovenous laser therapy is a quick and effective process. The first step is a consultation and an ultrasound examination with your physician. Based on your ultrasound examination, your physician may determine that endovenous laser therapy is the best treatment option for you. Your physician will then answer any questions you may have about the procedure and discuss the costs and possible insurance coverage. On the day of your procedure, your physician or nurse will first map out the treatment area of your varicose veins with the marker. While the symptoms of your varicose veins may be apparent in your lower leg, the cause may be higher in your thigh, where the endovenous laser procedure will be performed. After ultrasound mapping, you will lie on the procedure table and local anesthesia will be used to numb the treatment area. A small puncture site, usually below the knee, is made with a small needle. A wire, sheath, and laser fiber will then be inserted into the vein to direct the laser energy to the treatment area. The laser console is then activated, delivering laser energy through the fiber to the vein. The laser fiber and introducer sheath are slowly withdrawn as the laser energy is delivered, causing the vein to close. The actual laser treatment usually takes less than 5 minutes, and most patients feel little or no sensation in the treated leg during the procedure.
A small amount of local anesthesia will be placed along the laser fiber, and at that point, once the skin has been anesthetized, the laser fiber can be pulled back at no discomfort to the patient.
After treatment and elimination of the unhealthy vein, the blood that would have flowed through the closed vein simply flows through other healthy veins and back to the heart. When the endovenous laser procedure is completed, a bandage is placed over the puncture site and your leg will be wrapped to aid in the healing process. Your doctor will ask you to wear compression stockings for a few days and to follow other guidelines.
Once the procedure is done, we require the patient to be in constant compression therapy for 24 hours. This ensures the vein is compressed and completes the ablation procedure. They'll walk out of the office and have a normal day. The following day, they're able to remove their stocking, shower, and wear their compressive dressing daily for 10 days. We recommend that the patients take Motrin therapy 3 times a day for 4 days following the procedure. This helps prevent anti-inflammatory discomfort. Upon leaving the office, they'll make a follow-up visit for the next 3 to 4 days, at which time we'll reevaluate the great saphenous vein. During that 3 to 4 day period, we'll encourage the patient to walk frequently and to maintain normal activity.
Walking immediately following the procedure is encouraged. Most patients are able to return to normal activity almost immediately. Patients may experience minimal bruising, a tight feeling, and soreness in the treated leg for 3 to 5 days after treatment.
I was able to return to my normal activities right away. The nice part about the procedure is, you get off the table and you're walking, you're going home, they encourage you to do your own daily activities. So I don't feel like I missed a beat at all. One of the nice things about having the procedure done is I'm a runner, and afterwards, before I had the procedure, I would experience the swelling, the aching, the crampiness, and I don't feel like that I have that anymore. It's I won't say it's totally eliminated from the standpoint of that I run, and so you're going to get some aches and cramps, but they're muscle related, so it's not the leg throbbing like it was. And then I also feel like I feel a little bit more confident in the summers. I think I'll feel comfortable going out in shorts, running outside, where before I would have just gone to the gym where it's air conditioned and I could wear the long pants and had my leg covered up. I would definitely recommend this procedure to any of my friends. If they are experiencing any symptomatology, I think that they should go and get the scan done. It's quick, it's easy, it's painless to determine if you have a problem with reflux, and then how well you feel afterwards and how soon you feel well afterwards. It's just amazing.
I feel vein therapy is very complex. The backbone of good vein treatment is the use of an ultrasound. The ultrasound identifies your truncal insufficiency and allows you to form a treatment plan. Endovenous laser ablation is by far the backbone of vein treatment. By taking care or fixing the insufficiency within the truncal vein, this allows the symptoms of tired, heavy achiness to be resolved. Frequently, there will be tributaries to the great saphenous vein that could require adjunctive procedures such as microphlebectomy. This can be looked at as if the vein was a large balloon and then deflated, and that deflated balloon then would need to be removed from the skin. Secondary procedures also include sclerotherapy, which can be used to treat spider veins. But it's to note that treating the truncal insufficiency is the first step in getting the patient better.
Endovenous laser therapy is a non-surgical procedure that is proven safe and effective for many people suffering from varicose veins. As with any medical procedure, endovenous laser therapy is not appropriate for all patients and complications may occur. You and your physician will decide if endovenous laser therapy is a treatment option for you. Insurance coverage for this treatment varies and may be limited. Please check with your insurance company prior to receiving the treatment. Vascular Solutions would like to thank Dr. Shuster and Tina Walters for their contributions to the production of this video.